Are you ready, kids?
To begin, what is ARDS? Thank you for asking, SpongeBob. ARDS is a type of respiratory failure where fluid begins to leak into the alveoli sac. During ARDS, there is some damage to the capillary membrane, which allows for fluid to escape the capillary and go into the alveolus. The alveolus now accumulates fluid and can collapse. This prevents normal gas exchange from occurring, and it can lead to hypoxia and then organ failure. Patrick asks, what causes ARDS? Well, any event that causes systemic inflammation can cause ARDS, and this can be indirectly or directly. With indirectly, the source is not the lungs, and this includes sepsis, burns, blood transfusions, drug overdose, acute pancreatitis, medication reaction, and chronic alcohol abuse. In the case of direct injury, the source is the lungs, and this includes pneumonia, which is the predominant cause of ARDS, aspiration, inhalation injury like smoke inhalation, lung trauma, and embolism. Systemic inflammation results in diffuse epithelial cell injury. This increases the permeability of the alveolar capillary membrane. The increased permeability allows fluid, proteins, debris, platelets, and blood cells to enter from the vascular compartment and into the interstitium and alveoli. This forms the hyaline membrane, which is impermeable to gas exchange. Plankton is asking about the progression of ARDS, and as Karen states, there are 3 stages. The first stage is the exudative stage. This stage is highly inflammatory. Next, we have the proliferative stage. There's a repair of the alveolar epithelium, and there's an attempt to remove some of the alveolar fluid. Finally, we have the fibrotic stage. This is the final stage. It is not visible in all individuals with ARDS. There's increased mortality, and there's chronic inflammation and fibrosis of the alveoli. Patients entering the fibrotic phase have low chance of survival. The progression of ARDS varies among individuals. For example, some patients survive the exudative phase and pulmonary edema resolves, followed by complete recovery. However, others don't. I'm glad to see Squidward showing some interest in ARDS, and he asks, what are the signs and symptoms? The signs progress gradually, but are very harmful. The initial signs are dyspnea, tachypnea, cough, and restlessness. SpongeBob displays these signs in the video. The symptoms worsen due to increased fluid accumulation and decreased lung compliance. As ARDS progresses, we see tachycardia, diaphoresis, changes in sensorium with decreased mentation, cyanosis, pallor, respiratory distress as work of breathing increases, and hypercapnia. After profound respiratory distress, there is pleural effusions, severe hypoxemia and hypercapnia, metabolic acidosis of target organs, and tissue hypoxia. SpongeBob's chest radiograph shows whiteout and white lung. Sandy wants to know how we diagnose ARDS. The answer is, there's no precise defining criteria for ARDS, but it is usually diagnosed with the presence of the following. There is testing for refractory hypoxemia, and here are the values that are tested. So on the right side we have the normal values, and on the left we see ARDS values. The partial pressure of oxygen is less than 50 millimeters of mercury, with the fraction of inspired oxygen being greater than 40%. The ratio of PaO2 over FiO2 is less than 200. Pulmonary artery wedge pressure is less than or equal to 18 millimeters of mercury with no evidence of heart failure. And finally, if the positive and expiratory pressure is greater than 5 centimeters H2O. Another diagnostic tool is chest auscultation. If there's scattered to diffuse crackles and wheezes, these can be used to rule in ARDS. Arterial blood gas measurements that show decreased PaCO2 despite dyspnea and hypoxia are also an indication of ARDS. Additionally, as we saw earlier, a chest radiograph that shows whiteout/white lung as infiltrates are widespread throughout the lungs is another indication. If spirometry indicates decreased compliance, volume, and functional residual capacity of lungs, ARDS is once again ruled in. Lastly, if the predisposing conditions for ARDS develop within 48 hours of clinical manifestation, that's also an indication. Mr. Crab wants to know how we would cure ARDS, but unfortunately there's no cure, only management. Mechanical ventilation is a primary treatment method where a high concentration of oxygen is provided in order to perfuse the organs and to ensure that they continue functioning properly. Fluid management is also used, but there is some controversy around this technique. PEEP is also used to increase the pressure in the alveoli at the end of expiration. This prevents the alveoli from collapsing and reinflates the alveoli that had already collapsed, and thus improving the ventilation-perfusion mismatch. Gary wants to know about the complications and the long-term prognosis of ARDS. Well, this includes the mortality rate of 41 to 65%, hospital-acquired pneumonia, which is quite frequent, renal failure, stress ulcers, barotrauma, and volutrauma.